and the non-good products. And then we should work using the tools. We can identify who has been infected, who is still infected, who has been no more infected. And this is together with the continuously or probably relaxed but very well controlled social measure, particularly in the working area and the general social life. I think this will be the thematic of this phase 2. And this obviously should be not 1 day old, because we have to do something and learn. Do something and learn. It's something again, Reza is very often talking about this. So people like Professor Reza that has to make the guidelines, has to understand and to be ready if something goes wrong to stop. The idea that if you find a new center of infection, you have to be immediately to go back to phase 1. Means to a phase where you make very significant stopping. But we can move to in this phase 2, step by step, where key problems are transportation. We have been building the last 20, 30 years our social system with mass transportation as a way to avoid pollution. Now you have to go back because you cannot make so many people in the underground, in the tramway, etc. So this is something we have to adapt. This does not mean that we have to destroy the system, because in the phase 3, probably we go not completely as before, but probably we go to another steps where social separation will be important, but less important, because phase 3 is when we'll have hopefully a vaccine. Still there is a question if we will have a vaccine. Always I remember that of the largest epidemic of the last 40 years, that is HIV, there is no vaccine today. And we don't talk so much about HIV because of the 35 million of deaths. These are by 95% in Africa and in very poor countries. But this type, today, our pandemic is touching directly people living in Europe, in North America, and this is a significant change of the attention of everybody. In phase 3, we'll have vaccine, hopefully, and we'll have drugs. So this will change because in phase 3, we'll be able to test the people, having drugs to cure the people that are infected, and probably if vaccine will add to have a capability to vaccine. With a big problem, because if we need 8 billion of vaccine, 1 for every man of mankind, actual production of vaccine for these things is 200-300 million of piece. So there is a gigantic problem of production. That is something we have to take care, but obviously a big opportunity for the pharmaceutical industry. But today it's a problem for the world because no one is able to produce 8 billion of something. So we have to see the world in these 3 phases, where phase 1 is what we just passed, where we demonstrated that with social separation and we've been able to limit the growth, not to stop. So you have to take care that today, in the future, COVID will be like other virus-based or bacteria-based things that we have in our life. But if we have drugs and vaccine, we can obviously work well. We can manage this. Phase 2, we'll have adding. We understand much more from phase 1. Plus, we have testing, so we can organize our life in the working space, in the common living space, with still based on social separation, but less aggressive, because we can do something and be ready for if we found area where the epidemic goes back, to be ready to a local phase 1. And then phase 3, when we'll have the tools to fight, as we do with other viruses in the world, to do that. So that is, I think this could be my major contribution to the discussion. In terms, and then I finish, in our organization here in Siena, we are an active project for developing drugs, monoclonal antibody-based therapy for the system. It's one of the many groups working on technology. And one of the questions I earlier get from other people, and the same to Reza, when a vaccine will be available, when cure therapeutics will be available. I think there is a lot of answer, but probably the average of the comment is that we have to think that the phase 2, so the phase before vaccine and or therapeutic drugs, will do at least up to the end of 2021. So it will be very difficult. We have availability in quantity before 2022 of cure of vaccine. So we have to organize our phase 2 in this approach, a regular, step-by-step, improving who is doing, how workers are organized, etc., but not thinking that you can just move in 1 day. I think it will be a risky. And as last contribution, I completely agree with the approach that the technical team where Rez is part of is suggested to government to have a system of continuous monitoring of the territory, ready to go back to what we call the red zone, so to the hottest of phase 1, in case we see area where there is a return of the epidemic above a certain level. Thank you very much.
Thank you, Dr. Landi. I think that was very clear on the 3 horizons and the 3 phases. Thank you for your contribution. I would, with further ado, I would invite Dr. Loreta Păun to share her views on the 2 topics. So back to work, how, and then what's the future of the access of the patients to the medical system in Romania, but obviously in Romania because that's taking place here, but also I think taking what Dr. Landi has also said. So Ms. Păun, please.
Good afternoon, and thank you for the invitation to attend this meeting. As Alexandra has already said, we are facing these days an unprecedented public health crisis, which force us to adapt quickly our entire activity. After we overcome this crisis, or before the second wave, we will need to evaluate our healthcare system from scratch. And we will need to consolidate the capacity for prevention and response in emergency situation or pandemics. This will be a challenge for all of us, for all the countries in the world, to harness the lesson learned and to strengthen our healthcare system so that we will be better prepared in the near future or in the future in general to prevent and to respond to other waves of this pandemic or to other pandemics. I just want to tell you that we mark this year's World Health Day at the Cotroceni Palace by signing in a virtual format the new biennial collaborative agreement between the WHO Regional Office for Europe and the Ministry of Health of Romania for the biennium 2020-2021. I'm mentioning this aspect because, as our president stated, the content of this document must be harnessed in the attempt to rethink the Romanian healthcare system and to consolidate its prevention and response capacity in emergency situations or pandemics. About Romania, the authorities, as you know, in permanent consultation with the President of Romania, have taken very early and appropriate measures to prevent the spread of the pandemic. The restrictive measures has been introduced gradually, depending on the stage of transmission of the virus. The results were notable so far, if you look at the statistics. The number of cases per million population in Romania is lower than in many other countries, with far better healthcare systems. And we owe these results to the authorities, to the medical community, the experts, but also to the entire population. The pressure on the Romanian healthcare systems is enormous. In these difficult times for all of us, the health workforce is in the front line in this fight against the spread of the infection. We all know that at the beginning of the pandemic, Romania's stocks were inexistent. No stocks of masks, no stocks of biocid. There were very few medicine, and they all have to be procured in the record time. There have been very small available funds, but we succeed to procure the necessary materials and medicine. And in this attempt, the use of the money coming from the European Union was a great success. All the restrictive measures so far were implemented in accordance with the recommendation of WHO and other international organizations, following the European Union guidance and the advice of Romanian experts, epidemiologists, public health experts, medical doctors. After strong debate and cooperation, briefly, the decision-making process was an evidence-based one. The communication also was clear and continuous and timely and effective, and also evidence-based at all levels, starting with our president and also with authorities, but also with health authorities, medical community, so that public trust is built. We are taking these days, as you said, about the easing of some of the restriction measures starting the 5th of May. And in this process, the same recommendations and advice will be followed. As our president mentioned during the press conference 2 days ago, it is very important to keep in mind that we didn't reach the peak in Romania yet. And a premature relaxation is fundamentally wrong. Therefore, measures must be eased gradually, as Professor already said, leaving sufficient time. WHO recommends 2 weeks between the relaxation of 2 measures so that the impact could be visible and properly assessed. Also, the president mentioned that we must be prepared to quickly reverse a measure if the number of cases will increase after it was eased. In regards to the healthcare system, it is very important to increase the financing. This was a stringent necessity long before the crisis in Romania. But it is now imperative to allocate higher funds, both from national and external source, and I'm referring at European Union funds, for medical devices, from medicines, for equipment for individual protection for our medical staff, and also for incentives for our medical staff. According to the WHO, it is imperative that the healthcare workforce is supported and protected in both the COVID-19 response and in resumption and provision of regular health service delivery. WHO recommends a dual-track health system management to reinstate regular health services, while at the same time continuing to address COVID-19. Regarding the workplaces, WHO recommends preventive measures to be established with physical distancing, hand washing facilities and respiratory etiquette in place, and potentially thermal monitoring. Relaxation of the measure requires maximum attention and a gradual implementation, and involves the authorities, but also the employers and the population. Even if measures are eased, the same hygiene and social distancing practices must be respected by the population. At this moment in Romania, a calendar including the relaxation measures and the optimal order of different stages in work is a work in progress. And our National Institute of Public Health is working on protocols for each type of activity. I know that Italy is already implementing these protocols. The optimal order from our point of view includes, first of all, gradual resumption of economic activity. Second, restart of commercial and other activities. Third, resumption of social activities. Fourth, reopening of schools and universities. And last, mass gatherings with a gradual increase in the number of participants allowed. The resumption of economic activity must be implemented gradually, avoiding the situation in which the entire population would return to work at the same time, while respecting some rules. First, social distancing and ensuring safety standards at work. It is important to have some special spacing rules, maybe changing the workplace spacing rules that exist, adequate ventilations, and so on. Second, providing protective equipment for the employers, masks, gloves, and so on. Third, an epidemiological triage is very important. We need questionnaires assessing the personal health and ensuring the thermal monitoring at the entrance using thermal scanners or digital thermometers. Fourth, organizing the way in which employers enter the shifts. In the fifth, strict hygiene condition at workplaces, washing hands with soap and water, disinfecting surface, sneezing in a disposable handkerchief, and so on. And of course, encouraging teleworking. This is a huge discussion about serological testing for employers, but I will let Professor Alexandru Rafila to comment. So, to conclude, as our president stated, it is crucial that the measures would be eased gradually, step by step, leaving enough time between two measures to assess the impact. And in case of an increase of the number of cases, we must all be prepared to reverse a specific measure. And it is very important that everyone understands that the danger has not passed and that a poorly managed transition can threaten the gains that we achieved with collective and overwhelming efforts. Thank you very much. Thank you, Alexandra. I don't hear you.
Yeah, can you hear me now? Yeah. Well, thank you very much for your intervention. I retained the expression breathing etiquette. I think that's something that's going to be new in our vocabulary going forward. And also it's a very good information that guides are going to be provided, because many of the participants have asked precisely this. Are there going to be guides available for companies in function of their nature of activity, number of employees, type of interaction with people? Are they going to be available for the business environment? And I think you've answered this, and this is a very good news. As we go forward, there are questions already related to your interventions. I'm now going to switch to Professor Giovanni Reza. We have introduced you, Professor, at the beginning of our conversation. I will briefly do it again. So you are the Director of Department of Infectious, Parasitic and Immunomediated Diseases of the Superior Institute of Health in Italy. Thank you for your participation. The same question to you as to to the rest of the panelists. Italy will go back to work on the 4th of May. So how are you going? Romania is going to do that starting with 15th of May gradually. How are you going to go back to work? What are you saying to companies, employees, and families and people? Thank you.
Thank you for your kind invitation. First of all, to summarize in a few sentences what happened in Italy actually in the last 2 or 3 months. And as you may know, we were the first European country to be heavily affected by this pandemic, because actually the index case was diagnosed on February 20, But when the first case that we call the index case actually was diagnosed, we realized that there were already generations of cases and the virus was circulating, had been circulating in the area of Lodi, that is in the southwest of Lombardia, the region Lombardia, for the last 3 or 4 weeks. Maybe the virus entered Lombardia in, let's say, mid-January, something like that. And so at the time we were observing the situation in Wuhan, we didn't realize that the virus was already in Italy, actually. And as a first response, we implemented the so-called red zone in 11 municipalities of the province of Lodi. What does it mean, red zone? It means that we applied social distancing measures and nobody could enter or go away from the area that it was called red zone. But it was already too late, because then we realized that the virus was already circulating in other provinces of the region Lombardia and also in the northwest of Emilia-Romagna, in particular in the city of Piacenza, that has a hospital hub. And many people went, to Piacenza from Lodi, let's say, to Piacenza. So the epidemic tended to expand by contiguity. At the same time, we realized that there were clusters of cases in Veneto, so in the northeast of Italy, but also in the east of Romagna, in Rimini, and in the north of the Marche. So the situation was quite compromised already at the end of February, beginning of March. So for this reason, on the 11th of March, the government decided to implement social distancing measures at the national level with the slogan, stay at home, stay at home. So it means that nobody should leave their home, and with the exception of people employed in essential services. That means doctors, nurses, a few activities from industries that were considered to be essential.
Professor Reza, we need you to speak a bit louder.
Can you hear me now?
Yes, we can.
Yeah.
And I think this phase, we have all passed it in Romania as well. I think in order for an efficient use of the time, I would invite you to tell us how you get out of this, and when you go back to work, what's going to happen.
Yes. So the point is this now, that thanks to the lockdown, the complete lockdown, the incidence of cases decreased, and we are monitoring everything with the mathematical models that give us the parameter R. The R, R is the number, the reproductive number of the epidemic. If the R is below 1, it means that the cases will decrease. If R is above 1, it means that there will be, again, an epidemic situation. So what are we doing now? We are in the process to reopen, as you well know, and next Monday will be a crucial day, key day, because many people will go back to work. What will happen when they will be back to work? We don't know, because many activities will reopen, but the reopening will be very gradual and partial. And we need to monitor very carefully this process. So there will be a step-by-step process, but we need to monitor it. So what we will do? We are setting up a series of measures in order to control how the situation will evolve. First of all, we need to measure the state of the epidemic, the evolution of the epidemic, because if the if we'll see that R0 will go above 1 for sure, we will have to do something, like to stop again some activities. Of course, we had to avoid a complete lockdown, because another lockdown will be really very bad for the economy of the country, but also for the citizens. So the monitoring system will be based on the number of new cases, but also on both at the national, the local level, but also on the measurement, on the estimate of the RT. That is the parameter I told you before, because we had to be very carefully with this process. I mean, we are very, very worried about another wave, another epidemic wave. And at the same time, even though there will be national level activities, there will be also regional activities. Then the regions have the capacity to implement certain measures if they are needed. For example, if they will see that there will be an increase of cases on their territory, for example, in a village or in a small town, so they can they can implement again red zones in order to try to contain the outbreak. And at the national level, we are trying also to improve the system of the monitoring system in another way. So there will be funds allocated to hire personnel for the local health districts, because we need to improve early detection of cases, we need to improve contact tracing, and also we need to increase the number of swabs that will be tested. So that is another crucial point, because there was a delay in testing people who had symptoms suggestive of COVID-19, and at the same time we focused the attention only on symptomatic persons. But now we are willing to test also people who are close contact of cases, even though they don't present symptoms. Why? Because we realized that actually that at least 10% of the transmission is due to asymptomatic people. So we had the experience of the region Veneto that was really excellent, was very good. They contained the epidemic with a strong presence on the territory. So they did a lot of contact tracing, they did a lot of tests, a lot of swabs, and in such way they reduced the number of people attending hospitals, and and also the number of people in intensive care units, because our major problem in Lombardy was the congestion of intensive care units. So now, step by step, people will go back to work, especially in the industries and in trade. There will be shops that will reopen, but of course, social distancing measures will be respected, should be respected also in shops, in industries, and in all the activities that will reopen. That means that, for example, if there's a shop which is less than 40 square meters large, only one people can enter, and the other people will wait outside the shop, and then within the shop everybody will wear masks. So there will be very strict measures, because really we are really very afraid about the re-emergence of the epidemic. In the industries, that is much easier, because the work can be organized and in a safe way with social distancing measures and with the use of masks. Schools will not be reopened probably, because our mathematical models say that reopening schools means that RT will go below and will go above 1 in a few weeks, and we estimated 1.2 in a few weeks, within a few weeks after the opening of schools. That is the reason why, even though there was some debate in the scientific community about transmission rates among students, we decided not to reopen schools, and also the other activities will be prohibited anyway. For example, concerts, cinemas, theaters, they will not reopen for sure for the next months. So this will be the measures that will be taken, but we hope really, we know that we have to improve our early detection system, our, let's say, early alert system, because we have to monitor very carefully the epidemiological evolution of to do that, we need, of course, to allocate also resources. That means not only financial resources, but also human resources. And so it will be a challenge, we know. There is also strong debate, big debate. Fabrizio Landi knows it very well, I think, on the media and in the political, between political parties, also within the government, because there are people that would like to reopen all the activities, you know, like just forgetting what happened only 1 or 2 months ago. That is really, I think, disappointing, let's say. There are people like me that are, you know, very cautious about the reopening process, even though I know that the economy, should be reopened, because otherwise, you know, there will be an economic crisis that will be added to health crisis. But anyway, we'll try to be cautious and to do everything in a partial and gradual way. But I hope that, I agree with Fabrizio, I hope that the phase 3 there will be soon a phase 3 with an effective vaccine available.
Now can you hear me?
Yes.
I'm sorry. There's a little hiccup with my computer here at the Institute. Thank you very much, Professor Reza. I think in Romania as well, we have people that are more conservative, people that are less conservative, people that are more economy-oriented, people that are more medical-oriented. I think you've captured all these differences very, very well. Now I will turn to the leader of the coordinator of our healthcare program in the Aspen Institute, Professor Rafila. Obviously, with the same questions, I will also take the opportunity to add already some of the questions that have been asked for the rest of the panelists also to think. I'm choosing one of the questions that appears in multiple prompts from our participants, and that is the future of telemedicine. In this period of time, it is clear that it appears in at least 3 prompts from our participants. So that's one of the things to consider, Professor Wan, in your answer. But also the same question to you, back to work, how? Please. Do you need to do something? Professor Rafila?
Yes, but you should close your phone.
Yeah, I'm trying.
Now it's okay. That's okay. Hello to everybody, and thank you for joining this webinar organized by Aspen Healthcare Quality of Life Program. And I'm glad to share experience with our Italian colleagues. And I think most of the participants are very interested in best practices and maybe examples regarding the guidance for their workplaces. And what I want to comment now is that we in Romania, we have some kind of different situation if you compare with Italy. And I formerly have some discussion with a chief medical officer from Veneto region, and they have a very good example in how they succeed in manage the SARS-2 infection. And we learn a lot from them, and maybe we have also we have the opportunity to learn from our Italian colleagues some important lessons. And because we will have this 2 weeks delay between they will start to open the economy and social life, and in Romania practically will be 18th of May, Monday 18th of May, so exactly 2 weeks difference. Maybe some of the lessons learned will be applied in our so here in the eastern part of Europe, you see it's something which is very difficult in this moment to explain. But the number of cases and the number of deaths, if you report these numbers to 1 million inhabitants, it's little and more than a little different if you compare what's happening in Western Europe. So we have around 500 cases to 1 million inhabitants here in Romania, and it's totally different with 5,000 in Italy. I don't know why. It's difficult to say because the measures were put in place maybe in the same time or in Romania and Italy. But what happened from the epidemiological point of view, it's in this moment a little difficult to explain. But the aim of our meeting is to answer to some interest of the industry, how they will be back to work. So regarding this objective of our meeting, I think all the industry is waiting for guidance for their workplace. And at the end of this period, until 15th of May, we, like health community and also the administrator of the public health system, should give to the industry guidance how to do it in a best way to avoid the spread of this infection. So I think the most important thing is for every company is to have a risk assessment and appropriate measures to be taken in order to minimize exposure to COVID, to resume work after a period of closure, to deal with a high rate of access, and also to manage their workers who work from home. And what I want to discuss is that this package of guidance, which should be included in this guidance for the workplace, should explain very well to everybody to have a very easy to understand material regarding the information about the virus, information about the signs and symptoms of COVID-19, to discuss how COVID is spread and how the virus is surviving on surfaces. It's important for everybody to know this because in this regard, they will be able to apply the preventive measures. So I think that if we discuss how to help the industry to prevent spread of the respiratory infection, including this one in the workplaces, how the workplaces are ready when people will be back to work, how the routine cleaning will be applied, and also the surface disinfection will be applied in every place, guidance to use the face mask and other protective equipment, and also what to do if one of the workers will be positive for COVID-19, after COVID-19 exposure will be positive and should be treated in a medical work. So all these aspects, I think, are essential to be put in a kind of manual. And if our Italian police have something also on their pipeline, maybe it will be useful for us to have access to this kind of material. And of course, then to see if this guidance will be applied, if the results of this guidance are positive, in order to avoid the enhance of the transmission rates of this infection. So this is, I think, our aim, maybe during this session, if we will be able to answer to some question targeted on this subject, will be more easier to change experience and to give advice, because only to discuss about the situation in Romania or situation in Italy, it's maybe less effective, and maybe people which are now invited to participate to this webinar are waiting for some answers from our part. Please, Alexandra, if you want to start the question session, I think it will be a good moment to do it.
Sure. So thank you very much, Professor. So one was, what kind of public healthcare policies are envisioned to strengthen the resilience of the Romanian healthcare system and restore delivery of care for other serious diseases, as the scientific consensus is that the pandemic will around or until large public vaccination will be available. For example, WHO calls on states to continue their efforts with vaccination to free up healthcare capacity by reducing the burden of preventable diseases. Is this or other policy opportunities to take long due decisive action to address chronic gaps in our healthcare system? I think the main question here, public policies on healthcare to strengthen the resilience of our medical system. That's one question. If you allow, I will ask. I will read 2 or 3 questions so that you can reflect on the answer. The other one was obviously the future of telemedicine, which, as I mentioned, appears in a number of questions from the audience. Another question is, how do you see the use of serology tests in the future? What is the point? What is your point of view on the role and the importance of testing for COVID antibodies? Is the development of guidelines regarding the place and the sequence of antibody testing and the presence of the virus by RT-PCR considered? So these will be a couple of questions that Professor Rafila, if you want to start already on a couple of them.
Okay, thank you. So thank you very much. Regarding, in fact, regarding the resilience of the health system, until now we were lucky in Romania, but because the health system seems resilient, because the number of patients which needs intensive care is not so big. It's around between 250 to 300 of those infected with COVID. So, but it was another question there. I think this question comes from Pfizer because they ask about vaccination, and it's important to vaccinate high-risk groups patients, especially elderly patients with conjugated pneumococcal vaccine, and of course with influenza vaccine in the next season. And you ask also about the access to healthcare and services, which is a big problem now because we have two types of let's say, which makes both patients and the medicine to retain to have medical services, because the patients are afraid they will be infected when they go in hospitals, and on the other hand, medical staff it's afraid to be infected even the patient is not symptomatic. And this is a big problem. And I read an article from an Italian journal 2 weeks ago. They showed that in Milan region, the number of deaths because of the myocardial infarct was 3 times higher during this period than in common periods. And this shows that every country have the same challenge of giving regular medical services, especially for chronic disease, but also for emergencies. And I think also for Romania, it's one of the most important things to put in place a resilient and accessible in the same time health system for the patients with different diseases, chronic diseases, and also for emergency. And I want also, I won't speak very much about telemedicine, because telemedicine will develop for sure, like working from home is the same example. Telemedicine will develop after this pandemic. But I will discuss a little about the serology test and the role of antibodies, because we still have a lot of discussion in Romania regarding the usefulness of this test. In fact, they are useful, but it's not useful to diagnose a case of infected person, because the antibodies appear in a period generally after at least 7 days after the clinical manifestation, and the sensitivity and specificity of this test are still debatable. And what is very important regarding the antibodies, we still don't have a quantitative test in order to identify which is the level of antibodies, and more of this, the level of neutralizing antibodies. And this kind of tests, which are available now, can give us only limited information. But there are strategies, and there are countries which already use this test for seroepidemiological surveys to see which was the spread of the infection in a certain population, in a certain group, or in a certain area. And for these types of epidemiological studies, these tests are useful, but they are not recommended, at least for WHO and the European Center for Disease Control. They are not recommended to test the suspect for suspect cases. They may be used only in patients which have symptoms and PCR is negative, and after some days you can test with antibodies, and if the EGM is positive, okay, take into account. Otherwise, using this test as screening test for suspects is not recommended, and it's not implemented as much as I know in European Union. Thank you very much.
You don't listen to. I don't hear you.
Can you hear me now?
Yes, because
Yeah.
as I told you,
Please.
unfortunately, I had to leave in 5 minutes. I want to give my small contribution. Telemedicine. If you remember my original talk, I think that back to work how will be based to a much more organized social separation. And obviously social separation will need tools And telemedicine is a very important tool. One, because on the side of keeping patient on the territorial level, as I remember, I was strongly suggested that one of the key limits of Italian care system, in part at least, has been the mention that there was too much hospital center activity, and the level of territorial medicine was low, particularly in the area like Milan area, Lombardy, we have more problem. So we have the demonstration that we did more territorial work. Of this will be important. So telemedicine, by definition, is keeping people with information from smart work side, because basically you don't have to physically be in contact with the with hospital, with healthcare professionals. You can send, not you physically, but you send your clinical data. That is, from a certain point of view, the same, because also part of telemedicine can also be a physical view of medical operator and the patient. So you don't have a physical touch, but you can have a lot of information. So telemedicine will be very important, from just understanding where are the people keeping at home with some symptoms, to understand people that are just in good health, to make regular tests that can be sent to the system. Whatever the system is, the doctors, or is an automatic system that evaluated based on the data science elements. So telemedicine is going to be very important, up to the point that it became very popular with the Korean experience, in particularly of the famous apps. Italy in this moment has been selecting one apps. Reza can explain all the debate about these apps that at the end, like in Korea, should tell you, probably it's not mandatory, but it's something that tell you if around you there are persons that are infected. In other words, people that have been infected in the past, you don't know who is physically, but you know that around you there are. Obviously, this poses a lot of questions, but to follow people, obviously, that are not symptomatic but could be at risk, obviously this will help the system. So again, you are in the working space, you organize the famous 1 meter distance, you organize differentiation when you go for lunch, the canteen should be organized differently, you should organize differently the toilets, so everything based on teams. So if something became infected, you don't have to stop all the factory, but you just stop the small unit of the factory that was sharing the same canteen, the same bathrooms, the same things. So this is the way to go. So to work, and this can be done more and more better, and telemedicine can help a lot. So on this side, I think it's important that to be organized, and this can be also done not only in the working in the sense of factories, but also in the working sense of offices, in the sense of school. Obviously, when you go to school, there is a question of very small children. That is why, as Reza says, the government has decided, and I share the idea, not to open school before September. Also with the problem that school, young children, as you know, are the one that can get infected, they get not so much symptoms, and they are safe. I think that out of the 27,000 deaths we have in Italy, I don't remember the number, people below 20 years, it's few numbers. I mean, something that stays on a few ends out of 27, if I remember well, the numbers of deaths. So on the other hand, this could be very dramatically in infecting older people. So the idea of school keep stopped was because you are going to concentrate young people that probably would be not at risk too much of the COVID disease, but then can be very much infected and transmitting when they go home their infections to parents or to grandparents. So that is why the decision was very dramatic, because obviously keeping children at home complicate the life of their parents that are going back to work. This is one of the major debate now ongoing in Italy, but on the other hand, you have to go. So the idea is step by step. I think telemedicine will be very important from making separation between patient and doctors. That is important. Territorial doctor, I mean. Making elements for who manage in the factory the back to work approach, because you'll have to, in factories, people will have to be organized. So someone who became an expert of separation. You need to have people in the companies that became, you have the chief operation manager, the chief manufacturing, you have the chief, I don't know, epidemic maintenance, whatever you call that. Someone in charge to follow the rules and then to adapt the route, because hopefully passing time by time the phase 2, we are at the moment we can relax more, based on the idea to keep always a monitoring system that in case something goes wrong, we can at least locally stop going back up to the red zone, as Reza was explaining before. So telemedicine is very important. It's very important the way to organize back to work and to have a very serious approach to this. Only last things about the serology test. The only question is the reliability of the test. Italian authorities have done recently an effort to identify a number of tests based on their specificity, sensitivity, negative prospective value, positive value. So to have something like when you go to do a test for glycemia or a test for whatever, you should use tests that are approved. In this case, approved means that they had a minimum accepted level of specificity and sensitivity. In the case of Italy, already a few has been approved. In fact, for instance, next weeks, there will be the purchase by central government of 150,000 of this serology test to test these 150,000 on 150,000 Italians that, from a statistical point of view, represent well the total 60 million. So to try to understand, you cannot do 60 million tests, they are not available. They analyze a subgroup of 150,000, see, testing this, what happens. So to see of these 150, how many has been exposed to the virus, and that, I think, will be important. That's it. Thank you very much. I'm going to leave, as I told you before, but thank you to everybody. And
thank you very much.
Thank you very much.
Thank you very much. Thank you. Thank you for your participation. Most welcome. I would like to address one of the questions to Dr. Paun, and I also have one question further on to Professor Reza. There's a question here that says, Ms. Paun, some countries have announced expanded strategies regarding getting tested for coronavirus. Is Romania contemplating a similar approach? Is it recommended for economic operators, in your view, to plan a testing strategy for employees? What is your answer to that? Thank you.
I prefer to not respond to this question because I already told you that the expert is Professor Afila, and we have a lot of discussion about this subject. So till now, we don't have a strategy in this field, but for sure, next week when we'll have the plan, we will have a decision in this sense. But I want to say, and I'm sure that some of your participants already know, because I already said that stringent necessity is to improve in Romania the research and the development of capacity in the medical field, especially the capacity to develop in our country medicine and vaccines. And also, it is important to invest in digital technology. This is essential for the future of all healthcare system, but especially for Romania. As you already know, digital technologies are useful not only for the triage for COVID, but also for tracing the contacts, as some countries already did. And this use of appropriate digital solution can serve to support health system and public capacity, especially those technologies who can help in providing, because I know that is a question in this sense, the safe and the remote care to patient, and also sharing reliable information for the public. And I'm really hope that after we overcome this crisis, we will be able to harness the lesson learned, as I already said. And one of these lessons is for sure referring to the digitalization of the Romanian healthcare system, especially because we own the potential to make this happen. And this is very important. And because our participants are representatives of business company, I think that they can be involved in the safe resumption of the economic activity. And I hope that at this moment, business community can contribute in a very different way, from producing masks and disinfectants to other protective equipment, of course, where possible. But companies can develop digital technologies to support public health measures. And I already collaborate very well with some of them in the last years. I'm just thinking about the hackathon for the health. It is a good time to implement this solution now and by now. So I'm very happy to be here with you, because there are a few minutes to finish. So I want to thank Aspen and especially to Alexandra for inviting me. Thank you.
Thank you very much, Ms. Paun. I have now a question for, obviously it's for all the panelists, but I would like to ask Professor Reza, because it's non-country specific. There's a question from the business sector here. What do you think, will open spaces at the workplace disappear? And if they will disappear, what will replace them? We can't hear you. I can't hear you.
Oh,
yeah.
Because actually we cannot reorganize everything in a while. So there are open spaces, and there are people working in open spaces also now that there is the complete lockdown in Italy. For example, just an example, journalists, or there are some companies that also use open space. What they are doing is to distance, to use some distancing measures between workers. So maybe the number of people working in the same room can decrease just because you keep some people on smart working. And I have to say that the use of innovation technology is becoming very important in this while. I mean, in Italy, we had been talking about smart work for a long time, but then we realized that it was possible just 1 or 2 months ago because of this pandemic. So there are more and more people using smart working, and that is a great thing, really, because it decreases the number of people in the same room, for example, in offices, and also public transports. Because one of the major problems is that you may also organize all the system and industry, a factory with social distancing, but then these workers have to go from their home, from their village, from their town to another town, maybe I'm working there. So the public transport system is very important, and if you use smart work, actually you can decrease the risk related also to the public transport. So it's, I mean, there are good solutions to apply. Of course, there are in some places you have to ensure your presence in order to work, but in other places you can use smart working, and that's the best solution. So open spaces might be used, but only if the number of people working in open spaces is decreased, and you can apply social distancing measures.
Thank you. I have a question here for Professor Rafila. Research and development of drugs became of strategic importance. A question from GSK. What could be the best proposal to the government in order to encourage this in Romania?
Okay, regarding R&D on vaccines and drugs, I think the problem is not the legislation. I think the problem is the way the legislation is implemented in Romania in some cases. And it's a very well-known example regarding the clinical studies. which Romania is at the end of the list regarding the access to clinical studies, and we have a problem, and this problem should be addressed in order to offer access to Romanian patients to drugs which are already tested and may be a solution for some of the chronic disease or infectious disease, and also it means very, very much for the Romanian hospitals and clinics which are involved in this kind of studies. Regarding the research and development by itself, like of course, here we should put in place a more comprehensive program to mobilize, in my opinion, the medical universities, because medical universities, some of them are involved in some research and development projects on specific drugs, but in Romania, the level of financing this kind of activities, it's very, very low. If you look to which percentage of GDP is allocated to research and development area, I think there are many things to be done, and here it should be like in education and healthcare, a change of optics, because these areas are not areas to spend money, but are areas to invest money. Because at the end of the day, the revenues in mid-term or long-term are much more important than the spend which are done in a certain period of time.
Now? There are a couple of more questions, 2 or 3 that I would like to. One of them is addressable to all the panelists, and regards the long-term investment in the medical infrastructure. It reads like this: do you estimate that hospitals, medical offices should invest in infrastructure and hardware, software, equipment for COVID trials on a long-run perspective, 2+ years? Is that an investment that you would advise for? You want to take this, Professor Rafila?
In my opinion, the investment in COVID-19 is not good if we discuss in long term, because there are 2 main points not to do it in long term. First, we should be optimistic. If we think that we need in long term to invest, it means that this problem will remain worldwide one of the most important public health issue, and I hope not to be like this, and to have a maximum seasonal infection if we won't be able to develop a vaccine, or to develop a vaccine which will be similar in effect with influenza vaccine. So this is one point. And the second one is that this should not be an investment from the private sector. If we discuss about preparedness plans and pandemic influenza, pandemic preparedness plan, we discussed about influenza until 2019, because all the time we thought with the avian influenza and so on. And WHO have launched, and all the countries approved this pandemic influenza preparedness plan or plans. I think this is a responsibility of the authorities to develop such plans, to have resources to deal with this kind of challenges. And of course, the private sector can help, but it's not the main player, because we discuss about public health issues, and the state is that one which should deal with this. That's my opinion. Of course, the private sector can help, but it's not instead of the state. It should help
Thank you. Other perspectives on this question, Ms. Paun? Mr. Reza?
Yes, we have a human potential which is incredible in Romania, as we already know, but we need increased financing with an increase in the investment in R&D, especially in the area of medicine and vaccines, why not? Investment in digital technologies and consolidated capacity for prevention and response in emergency situation or in pandemics. These are my conclusions. Thank you.
Professor Reza, your conclusions?
I mean, it's always a good thing to invest in health and in research and development. So, I mean, if this is an opportunity to invest in order to improve infrastructures, it's anyway a good side effect of the pandemic, one of the few good side effects of the pandemic. We did a very short-term investment in increasing the number of intensive care units places. That was the first thing to do, and increasing also these infrastructures. In the medium long term, I wouldn't know what to say. You know, we did some investment in the vaccine areas, and there were some public money addressed to, I mean, to improve and increase research and development on vaccines. But at the same time, as you may know, I mean, there are several vaccines that have already been developed, candidate vaccines that are in phase 1 human trials. So to invest now in order to start to work in 1 or 2 years, maybe it's not worthwhile. So, I mean, increasing capacity is always good also for future crisis. I'm not very optimistic about the future of this pandemic. I mean, it will depend, Professor Afila, actually, it will depend on the capacity we have to find to develop an effective vaccine. Also good treatments, I mean, effective treatments, but in this while, actually, I see that we have many randomized control trials ongoing, but based on the preliminary results, we don't have many very promising approaches. That's one of the main problems. With regard to vaccines, you know, we know that this candidate vaccine may evoke the immunological response and the development of antibodies. We still don't know whether these antibodies will be protective. I hope so, also for analogy with other infectious diseases. The point is that it takes time to produce a vaccine and takes time also to scale up the production. So I do hope actually that will be very fast. Who knows? I would like to be more optimistic myself, actually.
Well, thank you. I think on this note, we can come to an end to our webinar. And I would like to thank, first of all our participants. A lot of questions that were coming on my WhatsApp, on our mail, on our Zoom section of Q&A. So there is a significant interest in what the Aspen Institute dialogues have proposed to you, to the business community and the public stakeholders today. So thank you for all the participants, and also, and not in the least, I would like to thank our panelists for their time, their effort, and their preparation. It seems like a Zoom conference, but there is a lot of preparation, like for any conference, in the back. So I would like to thank you all for your contributions. There's going to be a paper that we're going to circulate with the main points of this discussion for the benefits of the participants and of the panelists. And with that, I would like to conclude our webinar. Thank you once again. Have a good evening.